By Paul Bristow, Conservative MP for Peterborough and member of the Health Select Committee. What do you think the Health Secretary will say, Paul?
Well, I'm hoping what he's going to do is, well as talk about the extra money that we're putting in, that also is accompanied by meaningful reform. That money just can't be wasted on NHS management, bureaucracy, and we really need to do things differently and increase productivity in the NHS to get those waiting lists down. That's what I'm hoping for.
So when I got elected in 2010, when the coalition government were in power, Andrew Lansley introduced some controversial reforms to actually devolve power away from the Secretary of State, which makes it difficult to make hospital leaders accountable for what happens in those hospitals. It sounds like Sajid Javid wants to take some of that power back. Do you think that's a good thing?
I think it's an excellent idea, because one, you've got problems with your NHS trust, we've got problems with your NHS waiting lists. When my constituents can't get an operation, they don't write to Amanda Pritchard, or they don't write to anyone at NHS England, they write to me as their MP. And so I think a degree of political control back in our NHS will help that accountability and transparency. To get that efficiency, what we need to do is open the doors of our NHS and get that transparency back in. A lot of that requires data, but when NHS trusts apply commissioning policies that are hidden on page 342 of a 400-page document somewhere, that can't be right. We need a transparent and clear NHS.
NHS figures show, Paul, that only around 50 to 55% of GP appointments are now face-to-face. That's down from 80 pre-pandemic, even though the government has said to GPs that they should now be seeing people face-to-face. Now, no one's saying there isn't a place for e-consultation, and no one's saying that there aren't doctors out there working really, really hard. I know many of them. Some of them are very close friends of mine. But I'm sure you've seen in your postbag, I've certainly seen emails from viewers and readers, many of them. People are having a hard time getting a face-to-face appointment. Shouldn't the Health Secretary mention that?
Well, you are absolutely right. There's no doubt that face-to-face appointments have significantly dropped. Now, look, I agree that we can look at new ways of working. I'm not against all of that. But if you need to see a GP face-to-face, you should be there and able to see your GP. And I think a lot of it's about actually freeing GP time up, actually. You know, I think they spend around 40% of their time either on bureaucracy or writing, fitness notes. I think we need to remove a lot of this bureaucracy away from our GPs. They also need to work more differently as well. They need to devolve a lot of prescribing now to nurses, now to pharmacists, so they can do what they're paid to do, which is see patients.
5.6 million on NHS England waiting lists for operations. We all know that is intolerable. How long is it going to last? How long will the number of people waiting for an operation be in the millions?
Well, I'm hoping that what we'll hear from the Health Secretary today is a plan to deal with that. And it's not just about money, as I said. It's also going to be about meaningful reform. We need to, like I said with GPs, about freeing up their time. We also need to free up our consultants' time. I'm fed up of hearing stories where consultants are spending one day a week in theatre. They need to be spending far more time in theatre. They can hand over some of the stuff that they are doing, the admin stuff and all this, to other colleagues. And it's about working smarter and more productive. And if we do that and we get it right, we can crack down those waiting lists and power on through them.
Doesn't the government need to get a bit tougher on some GPs? Some GPs, they do other NHS senior medical staff generally. They do other private work. They're often, the state pays for a large part of their education. Shouldn't we be getting tough now with the BMA, who, in the eyes of some ordinary patients, many ordinary patients actually, have been very obstructionist and unreasonable during this pandemic?
Well, I think it's carrot and stick. So at the time, I do think, as I said, their time is freeing up to be able to see people, and they need to be helped to work differently. But at the same time, they've got to reform the way they do things. As I say, they can't be wasting their time doing things that are unnecessary or that junior colleagues can do. This is a national effort now. Okay, we really need to power through that elective backlog in the same way that we did with the coronavirus pandemic. But can you think of a better, more positive politician to really kind of frame that national effort than Boris Johnson? That's what's needed, I think.
Paul Bristow, MP for Peterborough and member of the Health Select Committee. Great to have you on GB News.